मेरे प्यारे फार्मेसी के साथीदारों, आज हम देखने वाले हैं जॉइंट कमिश्नर सॉल्व क्वेश्चन पेपर फूड एंड ड्रग डिपार्टमेंट गुजरात गवर्नमेंट। हम देखें उसके पहले जो मेरे नए साथीदार आए हैं उसको गुजारिश है इस चैनल को सब्सक्राइब कर दीजिए और ये बेल आइकॉन भी प्रेस कर दीजिए ताकि जब भी मैं नया वीडियो अपलोड करूं आपके तक ये वीडियो जल्द ही जल्द पहुंच पाए। देखते हैं क्वेश्चन 1। The lambda max in alpha beta unsaturated acids can be determined by Woodward-Fisher rules, Nelson rules, Fisher-Kohn rules, all of the above. So that's very well known rules is Woodward-Fisher rules for lambda max determinations. Which of the following is an emission spectroscopy? UV visible spectroscopy, infrared spectroscopy, spectrophlorimetry, or none of the above. If we say these are the absorption spectroscopy and this one is our correct emission spectroscopy. IR spectra result due to change in spin state, bond length, dipole moment, none of the above. So the correct answer is dipole moment. What will be the spin quantum number for a nuclei with odd number of protons and odd number of neutrons? 1/2, 3/2, 0 or 1. So it is look like deuterium, 1 proton, 1 neutron. So deuterium is NMR inactive, so it is 1. Which of the following is the unit of chemical shift? ppm, ppb, Tesla, no units. So parts per million is the correct answer. ppm. Sublingual nitroglycerin tablet is preferred in angina pectoris because it is quickly absorbed. It avoids the first pass hepatic metabolism. It reduces the side effect by spitting a drug after desired response, all of the above. So in case of that, both are required. So all of the above is the correct answer. The inhibitory neurotransmitter in the CNS are glycine, aspartate, glutamate, gamma aminobutyric acids. So यहाँ पे glycine and GABA, these two are the inhibitory neurotransmitter. Preferred skeletal muscle relaxants in patients with renal failure is doxycycline, atracurium, pancurium, or none of the above. So the correct answer is atracurium. Following barbiturates are short-acting barbiturates except pentobarbital, methohexital, mephobarbital, omobarbital. So the correct answer is mephobarbital. All the following ACE inhibitors are prodrug except lisinopril, ramipril, quinapril, enalapril. So the correct one is lisinopril. Which statement about theophylline is incorrect? It is an agonist adenosine receptor A1 and A3. It elevates a cyclic AMP level. It has narrow therapeutic index, or it is a phosphodiesterase inhibitor 3 and 4. So the correct one is it is an agonist adenosine receptor. Which of the following drug is having a tocolytic actions? Tocolytic actions means it delay or control the premature delivery, pregnancy, magnesium sulfate, nifedipine, terbutaline, all of the above. So the answer is all of the above because they all are a decreased blood pressure. All the following are cytotoxic pyrimidine analogs except fludarabine, cytarabine, gemcitabine, capecitabine. So the correct answer is fludarabine. Which receptor in the CTZ is mainly blocked by the antiemetic drug ondansetron? D2 receptor, D1 receptor, 5-HT3 receptor, 5-HT2 receptor. So the correct one is 5-HT3 receptor. Clinically, which vitamin is supplemented as an antioxidant? Vitamin C, vitamin E, vitamin A, all of the above. So the correct answer is all of the above. Which chelator is indicated in mercury poisoning? Dimercaprol, EDTA, both, A, B, none of the above. So the correct answer is both A and B. Sir, Gram-Mottis stimulates development of granulocytes, erythroids, megakaryocytes. So in that case, all of the above. A cell undergoing the apoptosis show all this feature except cell hyperplasia, chromatin condensation, cell surface blabbing, cell shrinkage. The correct one is cell hyperplasia. In response to the intense light, the pupil is dilated rapidly, dilate slowly, constrict rapidly, constrict slowly. The correct one is constricts rapidly. Which is the most abundant type of hemoglobin present in adult blood? Hemoglobin A2, hemoglobin A, hemoglobin F, none of the above. So correct answer is hemoglobin A2. Sexually transmitted disease syphilis is caused by Treponema pallidum, which is a type of virus, bacteria, fungus, protozoa. The correct one is bacteria. Which immunosuppressive factor is released by the cancer cells? TGF-beta, galactins, both, A and B, none of the above. The correct answer is both. Which of the following agents stimulate release of insulin from pancreatic beta cell? Glucose, incretin, dipeptidyl peptidase inhibitor, all of the above. So we can say the correct answer is all of the above. Select a drug from the list which act as an enzyme inducer: erythromycin, isoniazid, carbamazepine, omeprazole. So the correct one is carbamazepine is enzyme inducer. Which drug is to be avoided during pregnancy? Atorvastatin, warfarin, methotrexate, or all of the above. So we can say all of the above. Idiosyncratic drug response are examples of which type of adverse drug reactions? Type B, type A, both, A and B, none of the above. So we can say it is a both A and B. Sorry, that is a type B response, because this is an idiosyncratic reaction. It is genetic, it is delayed action, so it is in type B. Which antiemetic drug has high potentials to cause extrapyramidal side effect which limits its use in the elderly? Ondansetron, promethazine, metoclopramide, all of the above. So the correct one is metoclopramide. A patient suffering from alcoholism was prescribed disulfiram for his de-addiction therapy. While he was under the influence of disulfiram, he attended a party where he drank alcohol. Suddenly, he developed a noxious reactions: facial flushing, nausea, vomiting, and headache. Which is the correct statement about the such interaction? So, disulfiram inhibited metabolism of alcohol and produce acetic acids. Disulfiram inhibited metabolism of alcohol and produce acetaldehyde. Alcohol inhibit the metabolism of disulfiram and elevate the level, none of the above. So the correct one is it produce an acetaldehyde. Which agent is a specific antidote for the belladonna and datura poisoning? Hyoscyamin, neostigmine, physostigmine, or homatropine? So atropine is controlled by physostigmine, or it is given as a specific antidote. Which is the contraindication for warfarin therapy? Pregnancy, thrombocytopenia, severe hypertension, all of the above. So in that case, we can say all of the above are the correct answer. Select an incorrect statement regarding the loading dose. Loading dose is required for a drug having a longer half-life, for shorter half-life, or loading dose is required for the acute treatment, or loading dose determine the volume of distributions. So we can say A loading dose is required for the drug having the shorter half-life. The participant's personal liberty, which freely permitted him or her to participate or withdraw at any time during the clinical trial study. So, autonomy, non-maleficence, beneficence, justice, and veracity. So, we can say it is based on autonomy. Transcription process take place in cell membrane, cytoplasma, nucleus, or ribosome. So we can say it is occur in a nucleus. Adrenergic beta-3 receptor are present in sweat gland, brown adipose tissue, cardiac muscle fiber, platelets. So it is present in adipose tissue. Hollow space in the middle of bones is filled with air, blood, bone cell, or bone marrow. So it is filled with the bone marrow से भरा हुआ होता है. How many bones are present in each upper limb? 32, 30, 34 or 28? So the correct answer is 30. Which transport system covers the symphoter and antipoders? Active transport, primary active transport, secondary active transport, passive diffusion, or endocytosis? The correct one is secondary active transport because it is based on ions. Which of the following stimulate the secretion of insulin, glucagon, adrenocorticotropic hormones, acetylcholine, or all of the above? So we can say all of the above. Which cluster of differentiation molecule is used as a marker for cytotoxic T cell? CD8, CD4, CD20, or CD45? So the correct is CD4. The blood volume ejected per beat from each ventricle is called stroke volume, which is about 60 ml, 130 ml, 180 ml, or 70 ml. We can say it is a 70 ml. Select an incorrect sentence about angiotensin II. It causes vasoconstriction of afferent arteriole. It stimulates the activity of sodium and hydrogen antiporter. It inhibits the release of aldosterone from adrenal cortex. It causes the rise in blood pressure. So it inhibits the release. It is incorrect statement. Which of the following is a general feature of the lipid bilayer in all biological membrane? Individual lipid membrane are free to diffuse laterally. Individual lipid molecules in one phase of the bilayer rapidly diffuse to the another layer. It is polar. The bilayer is stabilized by the covalent bond. ये सब नहीं होते. तो इसमें से आएगा individual lipid molecules are free to diffuse laterally on the surface of bilayer. Movement of water across the membrane is facilitated by protein called annexin, aquaporins, selectin, transportin. So the correct one is aquaporins. Which of the following is not a consequence of partial hydrogenation of vegetable oil? Longer shelf life, lower melting temperature, reduction of some cis double bond to the single bond, conversion of some cis double bond to the trans double bond. So the correct one is lower a melting temperature. A patient is suffering with the twilight impairment. Which of the following vitamins should be prescribed in such a situation? Cyanocobalamin, ascorbic acid, nicotinic acids, or retinol? So the correct one is retinol is vitamin A. So retinol acetate. Which of the following is incorrect regarding the nature of enzyme catalysis? Enzyme can change the equilibrium. It is next to impossible. Enzyme can lower the energy of activation of the reaction by catalyzing increase the molecular cohesion. ये नहीं आएगा इसमें. Enzyme lower the free energy. No, it lower the activation energy. Enzyme cannot change the equilibrium positions of the reaction it catalyzes, but lower the energy of activations of the reaction. So this one is the correct answer. Exon skipping is associated with nonsense mutations, regulatory mutations, RNA processing mutations, silent mutations. So it is RNA processing mutation is exon skipping is associated. The most common cystic fibrosis mutation is consists of deletion, duplication, substitution, insertions. So the correct one is deletions. Callus is a tissue that forms embryo, that's insoluble carbohydrate tissue that grows to form the embryoids. Callus is an unorganized actively dividing mass of the cell maintained in the culture. So the correct one is D. Name the type of culture which is prepared by inoculating the cell directly from the tissue of an organism into the culture media. Primary cell culture, secondary cell culture, cell line, transform cell culture. So the correct one is primary cell culture. So this is our second last video of Joint Commissioner Gujarat Government Examinations paper solutions. The last video I will prepare and send to you immediately. If you want any more video like this, you can make the comment, or if you like this, then share and subscribe. Thank you. Thanks a lot.